Good morning, everyone. For what I'm about to demonstrate for today is the hand X-ray. First, we will address the correct patient position. Before taking the X-ray, be mindful of jewelries and other accessories on the hand or the part of interest. On the PA projection, we will use the image receptor of a 8 by 10 inch for hand or average of 10 by 12 inch crosswise for 2 images. Position of the patient. Sit the patient at the end of the radiographic table. Adjust the patient's height so that the forearm is resting on the table. Rest the patient's forearm on the table and place the hand with the palmar surface down on the IR. Spread the fingers slightly. Ask the patient to relax to avoid motion. Prevent involuntary movement with the use of adhesive tape. Central ray. Central ray is perpendicular to the third MCP joint. Collimation is enough to the third MCP joint or the marker. The structure shown on the PA projections are the carpals, metacarpals, phalanges except the thumb. Inter-articulations of the hand and distal radius and ulna are shown. Next, we will proceed to the PA oblique projection, lateral rotation. The image receptor is the same as the PA projection of the hand, 8 by 10 or 10 by 12 inch, crosswise for 2 images. Position of patient. Sit the patient at the end of the radiographic table. Adjust patient height to rest forearm on the table. Rest the patient's forearm on the table with the hand pronated and the palm resting on the IR. In PA oblique position, projection, we will use the sponge, a 45-degree foam wedge to support the fingers in the extended position of the IP joints. Position the hand on the sponge. There are two positions of the PA oblique projection. The one we will introduce the sponge to show the joint spaces and the other without the sponge to show metacarpals. The central ray is the third MCP joint. Collimation is 1 inch all sides of the hand, including 1 inch proximal to the ulnar styloid. The resulting image shows a PA oblique projection of the bones and the soft tissue of the hand. Next, lateral projection, mediolateral or lateromedial extension and fan lateral. Position of the patient. Alternatively, place the radial side of the wrist against the IR. This position is more difficult for the patient to assume. If the elbow is elevated, support it with sandbag. Extend the patient's digit and adjust the first digit at a right angle to the palm. Place the palmar surface perpendicular to the IR. Center the IR to the MCP joint. The two extended digits positioned result in a superimposition of the phalanges. A modification of the lateral hand is the fan lateral position. It eliminates superimposition of all but the proximal phalanges. For the fan lateral position, place the digits on a sponge wedge. Abduct the thumb and place it on a radiolucent sponge for support. Central ray is perpendicular to the second digit MCP joint. Structure shown is the image which shows a lateral projection of the hand in extension. It is the customary position for localizing foreign bodies and metacarpal fracture displacement.